in this week's Cardiology Countdown, we'll begin at the number 3 spot with a new journal that will be released from CardioSource. You'll be getting it in your mailbox this week, called CardioSource WorldNews. And as you can see, I think from the cover page, this will be a different type news journal magazine aimed at having clinical science, all of what's going on in cardiology, some of the latest numbers and new people, technology, lots of fun things, some tough cases, trial summaries, but to be a little different and hopefully be a new type of publication to help you keep on top of all that's going on in cardiology. Now, this week's number 2 spot is a very interesting article from Denmark, where over a 10-year period they tracked patients with atrial fibrillation and looked at interruptions in warfarin. Now, out of 48,000 patients, they found that over that 10-year period, 35,000 of them had an interruption of at least one time period. And over the next 90 days, the rate of stroke was 31%, which is enormous. Now, this is an observational study, and that trails off over time down to about 11 events per 100 patient years. And so it highlights what we would all expect, a higher risk of stroke when interrupting warfarin for, during treatment of atrial fibrillation, but reminds us that it's an ever-present risk that one needs to treat. And at the number 1 spot is a fascinating article looking at subclinical atrial fibrillation and other tachyarrhythmias, a study in the New England Journal with 2,500 patients that had pacemakers and devices that could monitor atrial rate. And they found that over a 90-day period, 10% of the patients had likely atrial fibrillation with tachycardic heart rates for a prolonged period of time. And then of those patients, they had a higher risk, about a 2.5 hazard ratio of developing a stroke relative to other patients who did not have those atrial tachycardias. And this is subclinical atrial arrhythmias, and so raises the specter that there are many more patients at risk even beyond those that we know of with chronic atrial fibrillation or paroxysmal atrial fibrillation clinically. And so for this week's CardioSource World News and CardioSource Video News, I'm Chris Cannon.